Good morning, I'm Adam Sexton. The Senate wrapped up its work for 2025 late last week, pushing some key votes into next year. We were all set to have Senator Maggie Hassan in studio, but then weather and travel delays conspired against us and forced us into a different arrangement. So, Senator, thank you for joining us remotely from Washington today for Close Up.
I'm really glad to be here. Thanks for having me.
So when the Senate gets back to work after the Christmas holiday, you're not going to have much time to get a deal done on the ACA subsidies. Is this opportunity slipping away?
Look, it is critically important that we extend these tax cuts that help Granite Staters and millions of Americans afford their health insurance premiums. It's obviously important to these individuals and families, not only for their own health care, but at a time when costs are skyrocketing in so many other areas, necessities like housing and groceries and energy. We really have to get this done. It's also important for our overall healthcare system because when fewer people are insured, expenses for everybody goes up. So we continue to have constructive bipartisan talks right now. As you know, we voted in the Senate week before last on a Democratic bill, and it actually turned into a bipartisan bill because it got bipartisan support to extend these tax cuts for 3 years. Some House Republicans have now joined House Democrats in pushing for a discharge petition, so they will have a vote on a 3-year extension as well in early January. And now what we need to do is find common ground so that we can get the necessary votes in the Senate and the House to extend these tax cuts, address some other concerns. There are some reforms that some Republicans have pushed for, some of which make sense to some of us. So there's common ground here, but we got to get it done.
At this late stage in the process, with some states locking in costs and plans, how do you ensure that this money, if it goes out, doesn't get gobbled up by the insurance companies at the corporate level and gets to the patients and the consumers? Because this is one of the criticisms the Republicans have. They say this is just a giveaway to the insurance companies.
Well, look, first of all, there are guidelines and constraints in the Affordable Care Act with regard to the amount of money insurers can keep versus what they have to spend on actual claims. But let's take a step back here. The Republicans have known now for months, because we have been pushing them to come to the table, that these tax cuts were expiring, that these tax cuts are essential to keeping American families from facing a health care calamity. And it wasn't until we have pushed this issue over the last few months. You know, a lot of us voted to keep the government open, but also extend these tax cuts, and we couldn't get Republicans at the time to join us on that. They now finally are hearing from their constituents, or seem to be paying attention enough to this. And at the end of the day, right now, the only way people can afford their healthcare.gov, certain people can afford their healthcare.gov coverage, is to make sure that these tax cuts continue. Now, the Republicans should have joined us in extending these tax cuts earlier when it would be easy to implement, but they haven't. Now what we hope to do is make sure that any bill we pass will extend the open enrollment period so people will have a chance to make changes to their health insurance choices, and to make sure that the health insurance companies are rebating money where it's appropriate. Those are some details to work out, to be sure, but at the end of the day, they can't be an excuse for inaction.
Are there any red lines for you, though? I know you voted against a deal that included additional restrictions on abortion and transgender-related care. Does that red line hold if you get this scaled back? And again, Republican majorities, there's going to be stuff in there you don't like. You know, if there are still restrictions on transgender-related care, say, but you get the ACA subsidies back or substantially restored, would you still be voting against it?
Well, let's be clear. There's bipartisan support for the Democratic bill in the Senate and now the Democratic bill in the House. The Affordable Care Act already has high policy restrictions, so public money in the Affordable Care Act cannot be used for what are called elective abortions. That remains the case, and there's no attempt to change that by Democrats. There's bipartisan support for the bill that we took a vote on the week before last that didn't have any further hide restrictions or any restrictions on other kinds of care like the transgender care you're talking about. It's really important that we focus on extending those tax cuts so people can afford their health insurance. That's what this is about, and we continue to have these negotiations, and I think some good faith discussions growing out of this.
You mentioned the vote to reopen the government. There's a good chunk of your party's base that is still pretty miffed about that vote from you and Senator Shaheen. Are you surprised at how many Democrats wanted the suffering inflicted by the government shutdown to continue for the very people that they claim to want to defend during the DOGE process, who were in the tank and not be getting a paycheck those last few months?
Well, look, as I said before, I voted multiple times to keep the government open as well as extend these tax cuts so people wouldn't face this healthcare calamity. It became clear over the course of the shutdown that Donald Trump was willing to inflict maximum pain on people who are the most vulnerable and maximum pain on hardworking federal employees, including people like air traffic controllers. So it was really important that we put a stop to what the president was doing. He was pitting essentially sick children against hungry children. Our most vulnerable people who needed, for instance, heating assistance as the weather was getting colder, against people who need health care. So at the end of the day, what we did is sat down with some of our Republican colleagues, and we got an agreement that meant that we were fully funding food stamps for the remainder of this fiscal year, that we were fully funding the VA for the remainder of this fiscal year, funding rural development, and making sure that the administration had to hire back the thousands of employees they laid off during the shutdown and protected those employees from further layoff into the future moving forward. So we got an agreement that protected our most vulnerable, reopened the government, and then part of that agreement was this vote on healthcare, which has now gotten bipartisan support, created the momentum you're now seeing in the House of Representatives, and brought the Republicans to the table, and also restrained the president from taking more and more unilateral action that he was taking during the shutdown. So at the end of the day, this is about making sure that we were assessing the situation as it existed, making sure we were protecting our most vulnerable, and continuing to fight for health care. And that is something that continues to this day. And while I cannot guarantee what will happen in January, we are having really constructive dialogue with Republicans, and you're seeing Republicans in the House now join with Democrats to push for that 3-year extension.
So you were just saying no guarantees at the end of January. If there's no deal on the ACA here, is there a valid reason to shut down the government again?
Look, I always think it is better to keep the government open. We will continue to push for a healthcare resolution. Let's be really clear. The open enrollment period for people who wanted to enroll in their insurance by starting January 1st has already closed. And one of the reasons that I went ahead and worked with Senator Shaheen and others to reopen the government was that the window for solving this problem was shrinking, and the Republicans were refusing to come to the table as long as the shutdown continued. The window is very, very small here. We have to resolve it this month, and that will include, I believe, extending the open enrollment period, or the Republicans are going to be held accountable for their failure to address a major concern, a major need of the American people, helping them lower healthcare costs at a time when not only their healthcare costs are skyrocketing, but so is everything else.
So just to clarify, January 30th comes around, you oppose a second government shutdown?
I will always vote to keep the government open as well as make sure that we're addressing critical needs of granted staters.
Okay, Senator Hassan, don't go anywhere. Let's stay connected. When we come back, the Brown University shooting manhunt ends in New Hampshire and reignites a debate over immigration. Stay with us.